Welcome back to Beyond the Plan podcast. Today, we're exploring ADHD in women at work, how it presents, why it's under-recognized, and how much performance gets buried under perfectionism, masking, and burnout. I first heard today's guest speak at an event, and within minutes, I felt seen in a way that I was honestly not expecting. I knew right away that I wanted to bring them on the podcast. So today we have Dr. Malika Hudani, Medical Director and Family Physician at JW Health, whose clinical work focuses on women's health, hormones, preventative medicine, and ADHD, especially in women who don't fit the traditional diagnostic profile, and Meriya Dyble, CEO at LeadrBuilt, who works with organizations to build systems, leadership development, and workplace structures that actually support neurodiverse talent. So let's get into it. Well, welcome to the podcast. Thank you so much for joining us today. Before we get started on the topic of conversation, I more so just want to start with how you two found each other.
So RJ is Malika's husband, and he and I did our MBA together. We graduated in 21, and through that I met Malika, and then we happened to start talking about ADHD and women's health
lives,
and went down a path, and we've just never sort of come off it because we always seem to have so much fun when we get together and talk about it.
I think it's cool too. Like Meriya, always has something else to. Another perspective change. That's the best thing about people with ADHD. You're just I never thought about that before. And when there's that insight and awareness, it becomes so much more fun because then you know what you're doing and you can be intentional with it. But Meriya's amazing in having you think about things in a different way. And a lot of us are kind of in our own bubbles these days. And I think the ability to meet someone and respect somebody and get along with them, but also respect their brain. Honestly, I tell RJ, I don't even know this, sorry. I tell RJ, I'm thank you for introducing me to Meriya. It's, as an adult, it's so hard to meet like-minded people, when you're outside of school and organized settings. You guys are this is a lovely office. I don't necessarily get the benefit of meeting cool people all the time. My patients are awesome, but people that I can relate to in a collegial fashion. So it was just, I feel really thankful honestly to have met you. I'm so gushing right now. But yeah, it's been fun, and it's literally because of a guy.
That's awesome.
Yeah,
that's awesome.
What a great guy.
What a great guy.
There you go.
He's
and
fabulous.
I agree. It is awesome as an adult, making friends is so underrated, especially ones that can relate with you on what you're passionate about. So separately, maybe I'll start with you, Meriya. What do you do?
Oh, that's a hard thing to say. So I lead an organization called LeadrBuilt, and we work with organizations to think about what are the skills that you're going to need for the future, what are you looking for from your leaders, and how do you systemize that in your programs and services. But really, at the crux of it, we're just focused on how do you create a better world of work? How do you set up people for success and bring out their best? And I think a great way to do that is through leadership. So that's what I focused on.
All right, awesome. And Malika, how about you? What do you do?
So I'm a family physician. I'm in my 5th year of practice. I'm a late diagnoser ADHD. And so I find so I was diagnosed a few years ago, and I find in my practice, I think I'm just people are gravitating attracts like kind of thing. And I'm attracting people that are sort of looking for similar answers as to why they're so capable yet never leading up to their potential. So I've obviously because of my own vested interest have sort of taken this by the horns, and this is now what I am fully invested in. I'm still a family doctor and I have my family practice, but the interest of how ADHD from when you're a kid to how it develops now, the impact of hormones, it's so interesting to me, and I think it's so applicable. Yeah, everyone talks about how ADHD is so sexy now, but it's not. It's been around for decades. It's been around for centuries. It's always been there, even when you go back into the literature. So I just want to make it I want to take away some of the stigma behind it. I want to show people you can be successful, you can be capable, and you can still have this disability. You just may not have known it was a disability. So that's why I'm here. Can be normal and also have a disability.
Yeah. Can you answer an ignorant question on my part?
Sure.
When I was a kid, I remember learning about it, and it was called ADD.
Yes.
Now I only hear ADHD. Are they the same?
Great question.
What is the lore?
It's literally they're the same. They're one and the same. I think the hyperactivity was included just to include the full breadth of the diagnosis. But honestly, if it was renamed today, I think it might have even a different name, because we know at the end of the day, it's not just about like your ability to attend to things. It's really a matter of having lower dopamine receptors, and how basically this puts you at sometimes an advantage, but most of the times at a disadvantage throughout your whole life. And how, as a kid, how your brain is developing differently from other kids. So when you were younger, listen, probably the same when like I was younger, we're like a little further apart in age, but not too bad. And like girls were like usually never looked at. And I know Meriya's got a bit of a different story, but I also think Meriya's case was like pretty unique and glaring. Like I think a lot of girls, I don't think my story is unique, but I think there's a lot of girls that fall into that second category of ADHD, which is inattentive, that are really like, they kind of don't get seen.
Yeah.
And they're like just fly under the radar, and they're like kind of never seen, but they're also socialized like not to like disrupt the peace. Like everything is internal, all of their symptoms and pathologies internal, and like the toll that takes on self-esteem as we go through life. Like the amount of feedback kids with ADHD have compared to kids who don't have ADHD is like I think the number is anywhere from 1,000 to 30,000 more times feedback that they've gotten. So
Wow.
it's terminology, but I think what we've benefited from over the years is understanding the various ways that it's presenting. So like I agree with you, like the terminology, whatever. Like autism spectrum is like sort of the same thing, right? Like there's used to be Asperger's. Now it's sort of like all under the same umbrella. The terminology, I think, is just there to maybe capture some more inclusivity. That's also like a little bit of like a, like not political, but that's a little bit of like a administrative, like what are we going to call things, or labeling things. But I think at the end of the day, recognizing that the impairment is there is probably the hardest but the most beneficial thing, because it looks different for everybody. So that's why I find so passionate about it, because like you think you might know, but like literally you don't. You have
So
no
that
idea.
makes me wonder, and I do want to loop back to your stories as well, but you made me think of a question. How is ADHD diagnosed? Is it clinical, like symptomatic, behavioral? Like if I come to you and I say, I think I have it, I know there are behavioral assessments and everything like that, but is there anything physiologically that you look for?
I like love this question. So like you're right, at the end of the day, it is a clinical diagnosis, and the way we diagnose adult ADHD right now is a little bit different than how we diagnose like ADHD in kids. There's a lot of neurodevelopmental tests that are available for kids, but when it comes to adults, a lot of this has to be based on clinical. And then what we also do is we get what's called collateral information, which is basically family history, like someone that's known you from a kid, because this is a disorder of childhood that is pervasive into adulthood. So you honestly, like the most common reason people come to me is like, I feel overwhelmed. Literally, like I used to be this like killer person. I had kids and I can't do this anymore. And a lot of times there tends to be like a hormonal shift. But people come to me because they are not functioning, and they've been to other doctors. They're like, I've been on all of the antidepressants. Like I've tried everything. What is going on here? I literally just had a meet and greet with a patient who like has a quite misfortunate like history where like she got pregnant. She had really bad like a really bad postpartum. She had really bad like premenstrual stuff, and like a lot of that are signs of ADHD. Not everybody with really bad like premenstrual and everything has it, but it's really common in the history. The history taking is so important because there are signs you can look out for. And then ultimately, like we gather all this information, we ask the questions too, because like we talked about before, a lot of people regard ADHD as a superpower. There is a lot of great things about ADHD, but at the end of the day, it's still a disability. And we need to figure out where that impairment is. So that's what we talk about. And then we figure out where the impairment is. And then I basically take this overarching picture, and then there are some formalized assessments we use. Funny enough, there's a really cool one out of the Netherlands called the DIVA-5, and they give pure examples about girls when girls were younger, and then they compare it to, hey, this is what it might look like when girls are older. And so it's a really great diagnostic tool to help inform specifically with girls, because we're not the kids that usually bounce off the wall. I was, but like I was also the other one. So it also can show you like someone that presents like a boy, just because you're smart, you'll get overlooked. So it's clinical, it's behavioral, it's collateral, and it's based on functional impairment. And at the end of the day, like it is individualized to you, which is why it takes so long to figure out. It can take so long to figure out.
Yeah, and I think like that's perfect because I was just going to give context to our listeners of how I found you both. And it was, we went to one of your events and you both spoke about ADHD, and I've always been of the belief that I'm like, well, whatever I have, because I have been told by people, hey, you probably have some sort of neurodivergence. Just people telling me that, you know,
You just heard that your whole life.
unsolicited advice be like, but the whole time I'd always tell people, well, whatever it is, it's working because I'm the 32-year-old CEO. So I'm not going to stop what I'm doing. I have a great marriage. I have a great job. I have great relationships. But then I was at your event and there were some other things that were brought up, like maybe you think you have a hearing impairment. I have been told also through unsolicited advice that I probably have a hearing impairment. Masking all day and going home and burning out on the drive home. I don't know how many times I've had the most productive, successful day at work, and on the drive home, I can't stay awake. I'm on the drive home and I'm like, oh my gosh, I am falling asleep. I got to get home. And then I get in bed and I pull the covers over me and I dissociate.
Wow, yeah.
So those are things that came up where I'm like, okay, maybe I thought that leaning into it was the best thing for me, but maybe there are some impairments that I should, you know, zoom in on and think, are there things that I could at least help alleviate those sides without maybe impacting the benefits of it.
Yeah.
So going back to your stories then, and I'll preface by saying I am undiagnosed. I still want to go get an assessment done. Am I allowed to go to you as my doctor?
Yeah.
Oh, heck
We'll
yeah.
talk offline. Okay. We'll talk offline. And I know we're going to lunch next week too, so.
Sweet. Okay. I'll get back to you on that one. I want to know more about your stories. Maybe we'll start with you, Meriya, like when you were diagnosed.
So I was one of the few people that was diagnosed young, few women for sure. And you'd mentioned ADD versus ADHD. So in my time, back in the 80s, it was ADD, so attention deficit disorder. And what's interesting is that I was hyperactive, much like you, and would bounce off the walls and do all the things. But I would also, on the other extreme, get really focused on something to a degree that people couldn't get my attention. And so my parents actually thought I had hearing problems because I wasn't reacting when people were trying to get my attention if I was focusing on something. And so I'd focus for a really long time, or I'd be off the walls for, you know, a certain amount of time. But when they got my hearing checked, it was fine. And luckily, at the time in Manitoba, there was a doctor that was known for ADHD, ADD at the time. And so I was diagnosed, and which was great because it gave me a lot of tools in my toolkit throughout my life to think about how do I start to use my strengths in ways that can benefit me, but then how do I utilize tools and, you know, different ways to let me know when I'm going off track or when something's happening that might hold me back. And so that, thankfully, that was really beneficial for me.
It must have been nice to like have those tools early on. Like,
yeah, it was. You know, I will also say what was interesting is that at times when I'd bring up, oh, well, I have ADD, and or I'd say something, people are like, well, that's not you. And so I actually got told a lot I didn't have things because it wasn't presenting in a way that people thought it should be, I guess, or that I was using it as an excuse or I was using it as a crutch. So certainly like in the school system, we didn't have IPPs or all of these things that would help you. And so I remember talking to teachers about how I would have certain difficulties with certain things. And yeah, they were just like, okay, get your stuff done and move on.
you're smart.
Get
Get it done.
Get by it. But
Wow.
yeah. So yeah, thankfully I did have the tools and you know, certain things around, like we did look at my diet. We looked at how much exercise I got. Certainly my sleep. My mom became very diligent with my sleep, which was great. And I could use those tools throughout. Yeah, I mean, the more tools in your toolkit, the better it is. I will just say that didn't prepare me for then when I, you know, hit different hormonal times, either as a teenager or then through perimenopause, that all of a sudden my ADHD presented in different ways. So the tools that I was using no longer worked for me. And so that became really frustrating. And, you know, to your point about, am I depressed? Am I all these things? Do I need to change up my medications? But it actually wasn't that. I needed to relearn how I can be effective.
That's, you know, like you say that so casually. But that's what I find about ADHDers. Like, man, we've been through it and we're resilient as hell. We've kind of like needed to be resilient. And so like, you just like the casual, whatever, we'll just like create a whole new whatever and we'll just make it work. Like, that's just a very like, you know, like so sick of like convincing people like you have this or whatever. Like, no, like I'm just gonna like do what works for me and hopefully educate some people along the way as to how to be more tolerant and aware, I suppose. I don't know. Like I think that's really cool, Meriya.
I agree. I think so too. And I think the resilience piece stood out to me because as women, we're also fairly resilient.
Yes.
Like you said, our life changes big time. Our puberty is intense and menopause is intense and everything is intense, and you have to kind of roll with the punches. And then if your hormones are also impacting your ADHD or what have you, that's really intense. How old were you
Oh
when you
my
were
gosh.
diagnosed?
Well, like, I don't know, if you ask anybody I grew up with, I was called the drama queen. I was the histrionic girl, chattermouth, loudmouth, everything bothers me. So I'll preface by saying like that's what I looked like as a kid. And so, you know, like as a kid like that, it's not really easy. And you feel things quite deeply. And, you know, there's a term going around related to ADHD and particularly like how we perceive emotions and how we perceive rejection and how we perceive criticism. And people with ADHD, when it's called RSD, so rejection sensitivity dysphoria. And so when people experience these symptoms, they are like so overwhelming, and you're almost like, does everybody hate me? You've seen those memes. It's like, does everybody hate me? Like that's like literally what it is. And I literally remember it was like 2000. Oh my God, I'm aging myself. 2008. So I finished undergrad. And my best friend and I at the time, she had just got into med school. I was like on the wait list to get into occupational therapy. And we went to New York with a bunch of girlfriends. And it was like the first like trip I've had with like a lot of girlfriends like that on my own. And I remember like the RSD was real. We were at the Met and we're in like the Egypt section, and she was with her other girlfriend. And I was like, are they fucking talking about me? And there was no reason to think anything was going on. Like, the other girl was a good friend of mine too. This is my best friend from junior high. And I remember in the middle of the Met, I lost it on them. I literally was like, are you guys talking about me? And I like lost it. Do you think I'm friends with any of those girls now? I'm not. But you know, it's things like that that have happened to me or I've been a product of over my life since I was literally, I could start talking to now. And so, you know, you're smart. And because women, we get a lot of feedback. We know how to mask well. I know how to keep my shit together. I will be able to keep my shit together for probably like 3 hours, and then you won't see the rest of me. And it'll be exactly like how you are.
Yeah.
Or you'll get to know me, and then 3 months later, I'll leave down my guard, and then you'll see the real me. And maybe you'll get to see those ugly sides. So like that's always like what's been a part of my story. And so it's really different than Meriya's. There was obviously like a lot of like not meeting my educational goals and coming to realize it's because I didn't learn in the same way as everybody else, but you don't think about that at the time, right? So my biggest reason for seeking help at the age of 37 was like, I'm losing all my friends. I'm literally like in a profession where people are supposed to look at me as a leader. And I know I'm not a bad person. And yet everybody is making me feel like I'm a bad person. And you're like, how do I feel so strongly about like, you know, the world and like, you know, like human rights and things like that. And like people are misinterpreting, you know, my actions. And so it's required so much introspection. And this is a really, I'm exposing myself, but like, whatever, I don't care. Like I said, like, I've already been there. I've already like embarrassed myself in life. And so like, I think if anybody can learn from this, if anybody hears my story, and I'll say the patients that I'm seeing that come to me are patients with my story because they've like been on the antidepressant. They've done the thing. They've been there. They've done the counseling. I've been like a million counselors. Like we know that there's something off, but we don't know why because we're technically functioning with everybody. So I went to go get assessed at 37, and it became, the reason was I was a doctor and people were coming to me and I was like, emotional dysregulation is a symptom of ADHD. And so this is not even in the diagnostic criteria. Yet we know people in the field, we know that this is because the impulsivity and the dopamine seeking behavior is why We get the dramatic, the big, the loud, and that's unfortunately
The
like
risk taking.
it's a risk taking. Yeah, exactly, the risk taking too, but it's not always compatible with everybody. So if you're somebody that's like generally like been able to do what they've done, but no one sees that silent struggle, you this might be you.
Don't you wish you knew then what you
Yeah.
know now?
You know what?
This is it, right? The tools in your toolkit.
Oh, Meriya.
If you could go back to the Met and just like take a big deep breath and be like, is this true, or like what am I telling myself right now?
Right.
And what have they actually done versus what am I making this mean?
And,
Like so many little things that if I could go back and do over,
So true. But like even to have that thought, right?
and
even
let
to be
people
like
love
that.
you.
I know. And like, you know, and like, so that's, you know, when it comes to relationships and trusting yourself and I think this is what really happens with women in general. Like we gaslight ourselves. We're like, do I feel how I feel? Like, is this actually how I'm feeling? Like, and we can like literally create a whole narrative because nobody's believed us. Nobody's like looked out for us, you know? Yeah, you know, and honestly, Meriya, like, I don't even think those skills would have helped me then. I think the meds are like really.
That was a big part of it.
Yeah, it is. Like, you know, there's a lot of things you can do with the skills, and it is skills and pills, but like there's certain things like emotional regulation, executive dysfunction that really require the ability of support with meds. And like there's different ways of practice and different ways of thoughts on the meds piece, but like when they work, they work. But it's not just like a Band-Aid. So yeah.
Oh man,
Long-winded to get to that.
There's so much you said there that I want to touch on. So something that kind of stuck out to me earlier, and you just kind of talked about it, is that ADHD, like scientifically, is less dopamine receptors, right? So when you and I related so much to your stories, a lot of your stories, and I want to say that you're one of the most lovable people I've ever met.
Thank you.
So
I appreciate that.
and I have a tendency to do the meeting after the meeting, is what my boss calls it, where you had this experience and then you go back home and you're like, did I do this? Was I this? Was I a jerk? Was I, blah, 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 all of those things. So I'm wondering if you think there's any correlation between the dopamine, you want the dopamine, maybe with that friend group, you always have a high level of dopamine. And then that one instance, they were acting a little bit different and you weren't getting that normal feed of dopamine. And so you have a breakdown. You're like, what is, because I've experienced that where usually with this friend group, I have so much fun. And then one time we hang out and things are a little bit off, but they might actually just be going through something personal. They might have a headache. But for me, I'm like,
you project.
You don't like me anymore.
Exactly. Okay. So that's an interesting one because people with ADHD, one of our superpowers is pattern recognition and picking up on the vibes. So we are really prone to recognizing when something is off. Because our brains can't tell what priority is what, everything feels dangerous. Everything is like elevated. Competing priorities is a really hard thing for our brain to deal with. And so the dopamine piece comes from, I think this is more about like the pattern recognition, recognizing something is wrong. And then, the dopamine receptor, we're already downregulated. So any sort of change is gonna not feel good for us. Any sort of inconsistency is not gonna feel good for us. And I think that's really what it's more about. But to the dopamine point, and how it sort of like affects our relationships. This is, you made a really interesting comment before, Meriya, about how, we have a lot of things in ADHD and like we make a lot of mistakes. We like fuck up a lot. And like ADHD is not an excuse for our behavior, but it's an explanation for why you are the way you are. And it's a start so you can try to do stuff. So I appreciate you said that because when we're like, oh my God, that's my ADHD, we're not trying to use it as a crutch. We're like identifying that this is something that's been part of our brain. And we're like, holy crap, there's a reason for this. And therefore I can do something about this. But going back to what I was saying, people with ADHD, again, this is not a black and white rule, but there is some propensity to like leave like your marriage or like step outside of a relationship. And part of that is like that sort of like dopamine seeking thing. And like, we don't necessarily like the calm things. We like the things that are like roller coastery and like then that already leads to like a slew of bad decisions and all of that. So I think that's a lot of where the dopamine can show up. The dopamine inhibition can show up. Our relationship to alcohol. alcohol loves us, we're not really good with it. And so how that affects our executive function is really different than how the average person who drinks like affects our cognition. So like it is so much more nuanced than we really even thought.
You know, it's interesting you said that because like I think that some people, you know, they appreciate when they show up with a certain group of friends, it's going to be the same way, they're going to interact the same way. And on the other side, you get some people that are in a really great relationship but almost get bored, and so they constantly want change. And so you do see a lot of people with ADHD as entrepreneurs. You see a lot of like high functioning people in organizations that have constant change have ADHD, and it's because that's a good hit for them. They actually quite enjoy that. And so where the rest of the world is like, oh, we're on a constant change roller coaster and we can't do these things, and I don't want any more change, you might have somebody saying, this is great. I actually really like this. I'm getting all the things that we need in this. And it still burns you out, because whether you have ADHD or any other brain, like your brain is only made to take in so many things every day and make so many decisions every day. And the more decisions you make, the less able you are to handle those decisions really effectively. And when you have ADHD, like, you know, think about it as, you know, a kid going through TikTok and all of the different things coming at you. That's basically your brain with ADHD. As you walk down the street, you're seeing 100 things more and taking in more than everyone else. And so you're making 30,000 more decisions, whatever the case may be. So when it comes to a point that you have to make a decision, like, do I interact with my friends in a certain way? You're not actually set up for success, because you've already like broken down your ability to do that really effectively. And then you go into, whether you've been drinking or not, the shame of why did I react that way? And why is this happening to me? And then we go after ourselves. And so, I mean, it's much like waking up after drinking too much and you go down your shame train, but that just happens to people with ADHD on a regular basis, the shame train. And they're still interacting and moving on in their day, and nobody would know it, but it's actually just working away at their brain. And so unless you're in that situation and you can start to recognize it in yourself, you can't stop it. You just live with it.
Yeah. Yeah. I actually, like, that's so interesting. You talked about the decisions. Yesterday, I had a particularly intense work day. Lots of decisions had to be made in my work day yesterday. And then I got home and my husband was out. He was at the gym, and then he got home and all he said was, "What do you want to have for dinner?" My brain literally, I was like, I don't know. And he's like, "Do we have anything at home?" And I'm like, "I haven't looked." And then he's like, "Do you want to order something?" And I'm like, "Tell me what you want and I'll put it in my phone. I can't do this." And I'm pretty sure he was just like, "What?" And then we went back to the couch and I was like, "You're coming off really intense right now." He's like, "You're coming off really intense." He's like, "I literally just asked what you want for dinner.
Why are you interrogating me about my dinner?"
Yeah, I called him intense. And then we like put on our show and we ate some food. And I looked at him and I'm like, "I'm so sorry. I was coming off intense, but I'm so overstimulated by decisions right now. That's why." And he, of course, was just like, "Okay, yeah, no worries." And then we just watched our show and we did our thing. But I was like, it felt like I walked into a house with music blaring and someone on a drum kit smashing cymbals and dogs jumping off the walls and stuff. It felt like that in my head, when really I walked into a clean house that he had cleaned, offering to order food for me and like putting on a show for me. But to me, it just felt like, because my whole day had felt like that. So it's interesting that you talk about the decision fatigue, because I was like, I can't right now.
Yes.
And he's like, "We'll order pizza." And I'm like, "Okay." Like,
well, and you're
order it.
flooded too, right? Like you're coming off this like really intense day, and like I don't know, like do you drive home? So do you like decompress on the drive, or like how
I do.
What do
Yeah,
you do?
I usually put on some music.
Good,
and I'll
yeah.
grab like a tea. I always
So you
grab
don't like fall
a
asleep?
tea on my way home. Well, and it's just a comfort thing for me. Like, it's a
good.
routine at the end of my day, no matter what time
good.
it is. Yesterday it was like 5:30 p.m. and I grabbed a caffeinated tea on my way home, because that's
Ooh,
my
you're playing with fire.
that's my unwind though. Like, that's
Yeah.
a tea and a hot bath at the end of the day that just brings my levels way down. But yeah, like the decision fatigue was just crippling, actually. Like, I couldn't even talk about ordering pizza.
Yeah.
As easy, that's a first world problem. You literally take out your phone and say, "Order the same thing I ordered last time."
Literally.
I don't even have to think of the decision.
But it's even engaging in the conversation, right? Is like is the cognitive load. You made me think about that talk that we had with 3WB and Dr. Munget, the geriatrician, and she talked about cognitive load and how women in general, like whether you have ADHD or not, have more susceptibility for cognitive load based on like how our brains are naturally just developed, like in biology, and how that can be a risk factor for Alzheimer's, and how like our risk for Alzheimer's is increased by that. So like I'd be curious to know in the literature like what the connection is. I'm gonna look into that actually, like with ADHD, the cognitive load that comes from that, because there are some studies that suggest ADHD untreated is a risk factor for dementia. And so it makes me wonder, like, is part of this the cognitive load? Is this just the inability to like make connections quickly? So it makes you wonder, like, as women and high-powered women, what we're doing to ourselves, and if we're not intentional about what we do, like how that can affect us down the road. So it's an
I
interesting
remember
comment.
she also talked about task switching.
Yes.
And that was another thing that my day was full of yesterday, was task switching, doing this and then doing this, doing this and doing this. And even in one conversation, there were several tasks at hand. How do we deal with this? What do we tell this person? What do we tell this person? How do we, and the task switching, I think for me was a big part of it.
Yes, I agree with you.
And she mentioned that can also be, and dementia runs in my family. So that's another thing that when I was sitting there, I was literally looking at the girls with me and I'm like, like, we got to all work on like focusing. And actually we walked away from that with some great tools. We decided we're going to walk away with that and block off our time throughout the day. So we're going to block off time at the beginning of the day for emails. Especially we have people in our workplace that have emails and in a live environment where they take chats and claims, and there's a lot of different things. And so I said, let's make it so that the first hour of your day is emails, have a coffee, start slow,
proud of you.
then get into this. Then at lunch, after lunch, another hour of emails, and then this, because I was thinking a lot of the struggles we're seeing are the bottlenecks that they popped out to me at that event. I'm thinking these bottlenecks are being caused by task switching.
This is so cool, by the way.
Yeah,
Like,
thank you.
look how, okay, this is like it sounds like you might have ADHD. We don't know. We have to do formal assessment. But if, like, this is the coolest part. You literally can take feedback and apply it in real time. Like, I don't know a lot of people that know how to do that other than, honestly, women leaders. And then a lot of times women with ADHD leaders. Like, that is really cool.
Yeah.
Because you literally are, like, protecting your people in real time. You literally took feedback from an actual doctor who specializes in this. And great for you. Good
Thank
for
you.
you.
Yeah,
That's amazing.
I was really glad that we went to that.
It was so interesting.
It was really, really interesting, and all the connections that were made.
The thing with that is that we talk a lot about accommodations at work, and even with your benefits, the reason that we love things like a healthcare spending account is because you can personalize it.
Right.
And we've built these workplaces for the masses, like as if we're still in, in a factory sort of getting things off the floor, but that's not actually how we work or how we know. And it's not that 80% of us can't work like that. We can, but that doesn't mean that we're optimal like that. And yet we've created these spaces for ourselves where we say, we want you to make a lot of money, we want you to engage a lot of people, we want you to do all of the things. And then we throw everything in your way that helps you not be able to do that as effectively as you possibly could.
Yeah.
So something as simple as, making it okay in a workplace to check your emails for a certain time of day and not feel like you constantly have to answer every ping and email as soon as it comes in, regardless of whether you're in a really important meeting or whatever the case may be. Like that alone could change the face of work for people and stop our, multitasking and task switching and all the things. And yet it's just not something that's talked about. It's not like the easiest things that we could do for everyone, regardless of whether you have, neurodivergence or not.
Yeah.
And it's just not leveraged like we could for some reason.
Yeah. Do you see that a lot in your coaching sessions that you do through LeadrBuilt? Like, do you see a lot of people that are open to making these changes in the workplace?
Yeah, it's interesting. I would say that they like to talk about it, especially if there's something like a special day. And so they want to focus on ADHD or neurodivergence or whatever the case may be, but not a lot of action. And I think part of that is people aren't realizing the number of people that are actually impacted in a way that we could help. And some of it's just pure, like there's so many things going on. And so where does that come in, the level of priority? But I think the more that we talk about it, hopefully the more that it will start to get embedded in places. But I'd like to see it more, definitely.
Yeah, I do
one
too.
person trying to make change in an office is very difficult versus 30
culture,
people trying to make change.
Yeah. Well, and I find that if there's probably a lot of people that are undiagnosed because of how their families perceived things and things like that. I know in my family, I come from a really big family. There's 10 kids altogether, and we have had several people diagnosed with ADHD as adults. And I have a little brother who's on the autism spectrum. He was diagnosed at like 11 years old or something. And that was kind of a result of my parents not being super comfortable with the outcomes or the labels and things like that. They didn't want, it wasn't, their intentions were good. They didn't want their kids to be limited or told they have limitations. And so they were hesitant to get diagnosis.
That makes sense.
I think that now what's cool is in the workplace, if everyone accepts that it can be something we work with, we work together on, we lean into, we will support you, we will make sure our benefits package has behavioral assessments or medications or whatever it takes. And the cool thing too with benefit packages now is, especially with us, is you can get a wellness account that covers the things that aren't covered by insurance. So my sister, one of the things that helps her a lot to decompress is going swimming. That's her big thing. She's like, if I am overstimulated, I just need to go to a pool and go swimming by myself. The sounds, the smells, all of that is so good for her. And so I think that that's like the more people that are willing to say, you know what, I think I might have this, or if I get diagnosed, I'm obviously being very vulnerable here on the podcast that I think I probably do have some sort of neurodivergence. And if I get diagnosed, I'd love to wear that at work and say, hey guys, if anyone else is wondering, we're going to cover behavioral assessments through the health spending account.
Oh, I love it.
We're going to do that anyways because it is covered. But, you know, we support you in getting this figured out, and whatever that means for your workspace. If you work better hybrid, you work better in an open office. And like you guys talked about, it's not one size fits all, because we have some employees where you go, oh, they're an introvert. They don't talk very much at work and everything. And then you talk to them and they say, oh, I love being in an open office environment. And you would expect them to say, oh, I don't like it. It's distracting. And then the most outgoing ones are the ones that go, I need to have a room that I can hole up in because I need quiet. And so I think that it's so cool that now it's more prevalent for people to be vulnerable, be honest about it, and then look to each other and say, you know, like Malika, I have a lot of, like everything you talked about to me was very relatable. And I think that we can, you know, recognize that in each other and recognize the nuances. And is rambling part of
It is 100%. It's called tangentiality. And a little bit of
tangentiality.
So you know how like we've heard the term the weave, like we do the weave, and sometimes we come back and sometimes we don't.
Yeah, like I don't know where my point was going, but I felt like I was hitting home with it.
No, totally. And I think, you know, to your point, right? Like everybody needs something different from this. And I think if you're a leader and you have a disability, like, and I say it's a disability because it is, and if you can wear it and if you can show people, like, so like in my clinic, for example, so RJ also has ADHD. He was misdiagnosed younger, having bipolar too. Oh my God, I'm like outing him, whatever. But it's fine. It's fine because he would tell anybody anyways. And that's actually like not what he had. And, you know, in reviewing like his medical, and like he's gotten formally diagnosed as well. But like, there's a lot of things in even upbringing where like you may have been diagnosed with one thing, but it was like literally something else. And a big reason for this misdiagnosis was like the internalized thoughts. And a lot of times like racing thoughts, like that's not in the diagnostic criteria like previously, but you can have so many like misdiagnoses. So we really at our clinic try to like tell people like we're neurodivergent, and I think people are like, you're functional, you're CEO, whatever. Like, how are you? Like, people don't understand like the scars we wear, the badges we wear, like the bruises we wear. So like, nobody's known how hard it's been for you to get to where you are, Same with me. And so like, that's also part of like the ADHD thing. We don't really show those scars because like, one, we forget about them. We're like, okay, we got our like goal. Who cares? Literally, we forgot. But then two, like, there's a big part of us that like care about justice and equality and things like that. We don't want other people to feel marginalized. And like, if we know a lot of neurodivergent people, who is already such a small percent of the population, like 8% at the max, or maybe more just because we are not diagnosing women, I don't know. But like, there's so many cool, innovative things that come out of neurodivergent people. So if you even just invest in your people in general, whether they're neurodivergent or not, like, you will come to know like those things that like make a difference, those things that, okay, so-and-so needs a water right after their meeting, I'm gonna just slide that over there. Like I'm not going to talk to them because I know they need to get this done. Like those little things, it matters, because at the end of the day, like who keeps your business going? It's the people. You have to invest in the people at the end of the day. And sometimes like leading by example, I think is like a really great way to like breed that trust. So like good for you for doing that.
Thank you. Yeah, it's
matters.
all inspired by like a lot.
It matters.
We've gone to a few of your sessions now, and I take away a lot of what is said, and I think that it's really important that people are understanding of their own development. Like you can come into something thinking, I have got this. I know what I'm doing. I'm a powerful woman. I'm a powerful person. And then you can go, yeah, but there are pieces that could be improved. I think that's so important that people know that, and that it's not something to be ashamed of, or to like, you kind of said, like, we carry these battle scars, these battle wounds. We forget about them or we dismiss them.
Right.
We dismiss our own challenges a lot of times.
True.
Like I said, when I came to your session, I thought, oh, no, I've got it made. I've got this figured out. And then you guys started to talk about the challenges, and I'm like, oh, dang, I think I have a few of those challenges actually, and that I could probably benefit from addressing those. So
Well, I think too, some of it's because the reason that you're able to be so resilient is because you likely have a very positive outlook and are able to look forward and move things forward. And so even if you've scraped your knees on things or things have happened, you have a tendency to bounce back and move forward and focus on what's next versus like dragging yourself into the past, which can be really positive for sure. But I do think there's something about, you know, sharing with people and sharing your story because you don't want other people to feel that way. But also people come to it with so many different ways of perceiving that. Like I would just say I have 2 kids, teenage daughters, and they both have ADHD. And so they've heard about it their whole lives. I got them assessed young. But they still carry this shame, I would say. And, you know, especially when it came to drugs. And in my oldest one in high school, I said, you know, you're really struggling. Why don't we just try and see if some of these medications, and she was very anti-meds. And when we dug into it more, it was because she had a bunch of people saying like, you shouldn't have to be on these drugs. You shouldn't have to. And so she got should all over, which is the worst. Nobody wants that. But so it held her back, unfortunately, because she wasn't willing to take things that if her friends found out, she would feel bad about it. And I kept on saying, like, if this could help you, you know, study easy or do all these things, why would you hold yourself back? Like, it doesn't actually matter what they think or what they say, but it's way easier for me to say that than her to actually internalize it and do something with it to move forward. So, I mean, I love women that are willing to share with another and be courageous and share their stories with, you know, the people they work for. And you can hear that over and over again as people are still holding themselves back, unfortunately.
Wow. I think I need to hear that, honestly. Like, I think I get maybe like a little too like optimistic that like the conversations are just happening so much more. But like, I also don't realize like the other side of these conversations are happening too, like the shoulds, right? And like, you should be able to do this, and shoulds, and
oh man, shoulds.
the shoulds.
I always tell people, don't stop shoulding on everybody.
Yeah.
It's the
Don't
shoulds.
say the word should, because if
hate
you're
it.
telling someone should, you're probably telling them something they don't want to hear or something they've heard a
wants to be
million
shit on.
times. Should stop shoulding on people.
Yeah.
I love
That's my
that.
big thing.
I'm going to use that.
Yeah.
Where I find the shoulds come up for myself and for patients is like, okay, so I'll give you an example. It's like in my family, like going to university, like being high achievers, like was already always very promoted. And I find a lot of people's like way with ADHD, the way they've lived their lives is a lot of times based on these shoulds. Like I should be like, and like a lot of them can be really adaptive. Like I should be working out three days a week, or like I should be like going to church or congregation or whatever. But then a lot of them, I think sometimes can put you in a box. And so like going back to the high achieving thing and breaking down with my therapist, she's like, well, like, why do you always feel like you need to achieve something? And I was like, well, that's what I should have always done. And she's like, but why?
Yeah.
I was like, but why? And so this was like when I first got diagnosed. So obviously I had to like go back, think about my purpose, but it's made me now pick up on like, are you doing this for you? Or is this the should that has been part of the ADHD brain? Because a lot of that is how we've been able to cope.
Yeah.
Is the shoulds, because this is what 90% of the population does, or what
Yeah.
we should be doing. So it's really interesting when you break it down, and when people get this diagnosis, they're like,
Yeah.
is what I'm doing because I've wanted to do it, or is it because it's what I've been ingrained and thought I should be doing.
You are like in my brain.
Really?
I swear. I'll be sitting relaxing as I should be able to relax with like a little bit of candy or something. And I'll be like, I shouldn't be eating candy. I shouldn't be sitting. I should be playing piano. I should be learning something. I should be on AI, learning about something in the news. I should be cleaning the house. I should be taking my car to the car wash. I should be. My brain is constantly like, why are you not bettering yourself at guitar right now? It's like,
You have all
because
this
I
time.
don't have to play. There's no reason for me to be always wondering what I should be doing. I literally have to tell myself I'm allowed to sit in bed and look at my phone for half an hour after a big day of work.
How hard is that for you to do though?
Really
Yeah.
hard.
Yeah.
It's so hard. It's like and having a treat or having, like a little drink or something, and it's like you should be drinking water. And of course you should, but there's balance to everything, and my brain is constantly telling me that I should be doing something to better myself, which in one hand has probably helped me a lot because it's probably,
Motivates you.
it's probably motivated me to make mostly good decisions. But if it's 9:30 p.m. and my brain's like, you should go to the car wash, that's a little bit like
I call those the ducks. The ducks. And I always tell myself, like, shut the ducks up.
yeah,
Shut the duck
I
up.
like that.
Oh, interesting.
Have you ever seen a duck on water? Like, it looks like it's so calm
yeah.
or whatever,
Oh,
but
but
the
then
feet underneath are like this.
sweating.
And that's our brains, right? Like, the
good
feet are
analogy.
just going and going and going. And so, like, how do you just shut the duck up and be able to just, like,
Just coast.
enjoy
Just let your
the
feet go.
time? Yeah. I've started taking drives. I drive to the cabin. It's a 3-hour drive, and I'll do it in silence.
What?
I literally just, there's no music, there's nothing. I'm looking at and it's something I've really had to train myself. But what I've realized is that I'm forcing my brain to like slowly come down over time. I mean, you can call it mindfulness, you can call it all the things, but, just like we train our brain to go to the gym, to do all the things, to whatever, you also have to train your brain to just slow down and be able to enjoy just being.
Just the drive.
Yeah.
Just enjoy the drive.
Yeah, and
I
it's
know.
really hard, but like
It's
I work
intentional.
on shut the ducks up.
I like that.
I like that too.
So, okay, what was yours?
Stop shitting on people.
Stop
Yeah.
shitting on people and shut the ducks up. I love it.
We're gonna go get
Put that in
tattoos
my-
after this, and we're gonna get those
done.
right now.
Done. Literally.
So I'm just going to loop back by going back to what we were saying with stop shitting on people. So something that I thought about when Meriya was speaking about her children with ADHD and the challenges they're facing is that there's still a lot of stigma out there. I would love to we're running out of time for now, but I would love to do a part 2 where we do myth busting, because I think that we could probably go and get a list of stigmas that are out there. I know I've heard lots of them. Aren't ADHD drugs just, micronized meth or something like that? Those kind of things, they're so stigmatizing. And so I'd love to book a part
So much
2
fun.
with you two where we go through those and myth bust them. But for now, as we wrap up, I'd like to discuss tools for people in the workplace, whether that's HR leaders, employers, employees, managers. What are some tools that you think would be good takeaways from this?
Should I go first? Okay.
Yeah, absolutely. This is like your baby.
Well, I think number one is just like, don't make assumptions. Don't think that, we just talked about myths, everything that means. It doesn't mean that somebody's jumping off the walls. So start it with just a conversation around, how can we best set you up for success? What would that look like? Are there barriers to you being able to get your best work done? Are there ways that we could be interacting that might make it easier for you to bring your best self? So these questions aren't specific to, do you have ADHD and, do you need a noise canceling headset, which might be great. But I think it's more about, let's really think about if you could design your optimal workspace and the things that bring out your best each day, what would that look like for you? And what could I, as your leader, do to help bring out that, on a regular basis? Or are there things that we could stop doing that maybe doesn't work for you? So just opening up those conversations and making sure that people feel like they can bring ideas forward. And they might not have them in the first conversation. So don't think it's a one and done. Come back to, once a quarter in your one-on-ones or in your team conversations, like, what's really working for us? And are there things that aren't working for us? And if so, what do we want to do about it? Like,
I
it's
love
actually
that.
pretty
I
simple.
love that.
Yeah, I love that idea. I want to take that away and go do that. Like, make a form that's like, if you could design your perfect workplace and then just give them free form to write, and then
That is really,
that's a
really
good
cool.
idea. Yeah.
I think too, just giving them a platform.
Mhm.
I think just to even be like, hey, what's the priority here? You know, like I think about like when I was in other work settings prior to being a physician, and like figuring out what was the most important thing to do, or the priority was really hard. So even having like just like small, like it doesn't even have to be a meeting, but like even just small like touch bases with your staff or with your employer, whoever, about like what the goals are for that day. Yeah, like certainly like for sure, noise canceling is always great, but even just like don't assume like just because they're not making eye contact with you that they're not hearing you. Most of us, every single one of us, does not look at anybody when we're talking. It's because we're processing.
Yeah.
And this is a very common thing with ADHD. We don't make a lot of eye contact when we're thinking. Not everyone's like that, but it's don't make the assumptions.
Yeah.
Like you see somebody and you have you have like an idea of what they're going to be like, but like I don't think if you ask anybody who works with me now, would they ever like think that I have an issue, right? So like we are really good at hiding it, and especially in a place where it matters. So like disengaging, disarming, I think is like really important. We talked about this before, like people with ADHD, we really suffer with like auditory instructions. Even just yesterday, I was with my husband and we were at an appointment and the doctor gave us instructions and we like literally took away two different things from this. I took away we had to stay in the room and wait for the nurse to come in, and he took away that we had to go, and like literally we were both there. It was like a 2-second conversation, and yet you can see how in a simple instruction can be so confusing. So it's not, you know, it's not glaring things you have to do, but it's about being intentional. It's about being thoughtful, and it's about using the resources you have to support your staff, because at the end of the day, it's the people that matter, and it's the people that you're investing in. So I don't know, it's long-winded, but
No, I think that's perfect. I think creating psychological safety in any regard is so important, and making sure that they know that they can express the tools, they can express their strengths, they can express where they need help. You know, if someone's giving verbal instructions, hey, do you mind giving me written instructions also on the projector or
even
something
knowing
like that?
to ask that.
Yeah, knowing what you need, I think is so important. So I think that's awesome. Okay, well, I'm sad to have to wrap up, but I think that we'll book a part 2. But for now, I just want to thank you both so much for joining the podcast. And yeah,
Thanks for
that was
having us.
awesome. Great
Yeah, thanks for
conversation.
having us.
Appreciate it.
Yeah.
If you want to learn more about today's guests, you can find Dr. Malika Hudani at jwhealth.com and Meriya Dyble at LeadrBuilt.com. And for more on how MyHSA is reshaping health and wellness benefits for real people in real workplaces, visit getmyhsa.com or find us on LinkedIn. Thanks for listening. See you next time.